Wonderful. Okay, well, welcome. I am so happy to invite you to our conversation sponsored by the Progreso Latino Fund. Make sure that we follow some of the housekeeping items. All participants, please remain on mute. If you have difficulties, please write it into the chat and the moderator will be able to support you. Please use the chat to submit questions or the Q&A button at the bottom of your screen. We will be monitoring that Q&A button and making sure that your very important questions are coming through to the moderators. I'm happy today to be here to talk about this very important issue. As a the Community Foundation board member, and as a person that is very committed to understanding the impact of multiple inequities in the Latino community, it's my pleasure to moderate this conversation that is mostly needed, and a conversation that is going to, was unearthed through the exposure to COVID and what it has done in many marginalized communities. But in particular today, we're going to be having a conversation in terms of how it is impacting the economic status of Latinos, how it is impacting more specifically essential workers, understanding that in terms of infection rates, Latinos are coming in sometimes second and third, depending on where they are in the country in terms of exposure, 2 to 3 times more than white counterparts in terms of exposure, and same, in terms of deaths. Also understanding that one of the reasons why exposure is so high is because of the requirement as essential workers and to have continued to work throughout the COVID pandemic. And in particular today, we're going to be having an incredible conversation with Maribel Rodriguez and Reina Hernandez, who are both in the home care environment, and their perspective in terms of how they have had to continue not only to work as a designated essential worker, but caring for the most fragile in our community in terms of its impact of COVID, working, despite the low wages, despite the fact that many do not have health insurance, so that if they are exposed, it causes a different layer of worry and panic for them and their families, and that it's mostly dominated by women, a field that's mostly dominated by women. I'm going to just, enter into this conversation from a very personal perspective. I am the daughter of immigrant parents who are from the Dominican Republic. My mother, who just turned 81 yesterday, and I had a wonderful conversation with her, is currently in a nursing home environment. And I have to tell you that for me and my family, it was one of the hardest decisions that we have ever made. First of all, culturally, it's not something that we tend to do with our elderly. We take care of our elderly, we're responsible for them. And making that decision was very difficult for me and very difficult for her in terms of transitioning. But my most important allies in this entire process is when I have to talk to, the nurses and the CNAs and the folks at the nursing home that are caring for her. I'm constantly on the phone with her, making sure that her needs are met. And I was able to successfully celebrate, her 81st birthday yesterday because of the special care that the workers on her floor continue to demonstrate to her, and the special care that they continue to demonstrate for me as a daughter who hasn't been able to see her mom since March. So this topic is not just a topic that I'm talking about from perspective of being, a professional in this field, a board member, but also from the daughter of a mom that currently every day I have to worry about whether she's going to be able to survive this, very difficult pandemic. So without further ado, I would like to introduce Gerald Garcia, who's going to have with us a very important discussion in terms of, the support of small businesses, small entrepreneurs that may be doing this work. And I welcome the conversation. Gerald, please introduce yourself and your many accomplishments and the way that you have positioned yourself to help the Latino community in many ways to find some kind of path through this pandemic.
Thank you, Dr. Akbar, and it's really a privilege and an honor to be on this panel, and thank you for moderating us. My name is Gerald Garcia. Most people call me Jerry. My family's originally from Vega Baja, Puerto Rico, and I was raised stateside, for the most part here in New Haven, a graduate of Wilbercross High School, played a lot of baseball, did well in school, stayed local for college, and have hugged the line between business and service ever since. I do work for government. However, my job is really fun, especially at times like these. I get to tell people what they can do, not what they can't do. And part of my job is first and foremost to work with New Haven entrepreneurs with an eye toward the Hispanic community, and help entrepreneurs to formulate their ideas about what they'd like to create, or if they already run businesses, to help them take their businesses to the next level. There's really no question that, and I'm stating the obvious, but COVID-19 has been absolutely devastating to our community and to all communities, but to ours in particular, both in terms of at-risk workers doing essential jobs, as well as those business owners among us. I do want to draw your attention to some of the services and opportunities that the city has, and also welcome the opportunity to speak with any of you who are joining us live, or feel free to add questions in the chat, as well as to contact us offline. We speak English and Spanish in our office, and so really happy to work with you. Some of the things that we do with small business owners, we offer a training program for earlier stage businesses called DNA of an Entrepreneur, where we meet now online once a week and form a kind of ecosystem around you, assessing some of what it is that you would like to do, what it is that you would like to create, and then help you create a path to actually getting there, with support for ideation, marketing, business planning, incorporation, all of the essentials that you need to get a business off the ground. For businesses that are further along in their journey, we've developed, we have targeted training. And then later, we have a relationship with Goldman Sachs and the 10,000 Small Businesses Program. I'm actually proud to say, I can't say which one, but the first New Haven business that was accepted to that program was Latino owned and operated. And really, really proud of them, and been a great experience for them. That's an MBA-like program that's all for free. And by the way, everything that I'm mentioning is free. Consulting with people who I work with and myself, to the classes that we offer, such as DNA of an Entrepreneur, up to and including Goldman Sachs. We have relationships with SBA, with SAMA, and many consultants and mentors around the area. And finally, we also connect people to financial resources, and wanted to make sure that people know about the partnership between the City of New Haven, the Community Foundation, HEDCO, and a private foundation that makes loans for Black and Brown and women-run New Haven, Derby, and I'm forgetting one town, Ansonia. And Ansonia run businesses of $10,000 to $25,000. These are 4% loans that 1/6 of which is forgivable, and there's no payment in the first year. You can find information on the HEDCO website. HEDCO is the Hartford Economic Development Corporation. And just going live this past Friday is a $5,000 grants program designed to be accessible and somewhat easier to qualify for through the Department of Economic Development, and that's through the CARES Act. And I can talk a lot more about the kinds of things that we do, but if would like to also make sure that others have a chance to speak. So I'll take a step back, and delighted to be a part of this conversation.
Thank you so much, Gerald. I appreciate that information. I'm sure that our viewers right now are very interested in many of the programs, and perhaps some of those questions will come in. We'll reserve all questions till after the panelists have completed their presentation. But please make sure that you jot down any specific questions that you may have. It's now my pleasure to introduce Maribel Rodriguez. And, you know, I hope I can do justice, Maribel, to your wonderful bio. I'll introduce you now, and I know that you will then introduce Reina. So Maribel was born in Puerto Rico and raised in Waterbury, where she lives till this day. She's a mother of 3, and she loves to spend time with her granddaughters. At a young age, Maribel felt very compelled to care for others. And so in 1987, she followed her passion for nursing and began a worker to work as a nurse assistant, where what is currently known as Autumn of Buck Hill, a nursing home in Waterbury, Connecticut. Over her nearly 30 years of service as a caregiver at this home, she cared for hundreds of elderly residents and led her co-workers to organize a union. And in her role as a delegate and executive board member over the last 20 years, she has led her co-workers as they fought and won, among other things, such as improved wages, a training fund to go back to school, affordable health care insurance, and defined benefit pension plan. In 2015, Maribel began working as an organizer with the union, where she has led several nursing homes in Western Connecticut in the same struggle for the respect and dignity on the job, and empowering members to get involved in the political arena to raise their voices in local state government in order to improve the lives of their community. She's an active member of Madres Latina, and has just done so many other things to impact the community. And, you know, Maribel, I'm going to just share with you how important your work is. And, you know, you represent all of the care workers that take care of my mom with the story that I shared this morning. So I'm so eager to hear from you in terms of the fantastic work that you have done, your fantastic advocacy, and how we can get more well-informed, especially understanding and knowing at this point that 68% of Connecticut nursing homes have been cited for the level of infections related to this virus. I mean, I'm getting calls every week that my mom has to get tested because there was a new infection, and the residents are so fragile. So please help us better understand that. You know, I would love to share and hear from you in terms of your perspective.
Thank you, Maysa, for that
You're
introduction.
welcome.
So yes, I worked in the nursing home for over 30 years. So I have a great experience in that field. I came out in 2015 as an organizer for SEIU 1199 to fight and improve wages and benefits for our members. As you know, historically, these jobs are low-paying jobs. In 2015, we started with the Fight for 15 for nursing home workers because the pay was low. So over the years, we fought to improve wages and benefits, but there's still a long way to go. Um, and then the epidemic came, the COVID-19 came, and that exposed uh, how these jobs are so critical in our state, and also uh, the hard work that these mostly Latinas and Black and brown folks do every day, and don't get appreciated as much as they should. Um, when COVID-19 came in early March, we quickly saw how these nursing homes were affected. Uh, Over 3,000 residents have died due to COVID-19, and over 14 of our members have died from COVID-19 also. And also over 4,000 members have been infected with COVID-19. So these members have put their lives at risk every day and have become very sick with this COVID-19. My personal story is that my sister is a CNA also, and she works in a nursing home local. And when the epidemic started, she also contracted COVID-19. And our biggest fear is, because our mother lives with us, that she would also contract COVID-19. So it impacted our family personally, uh, worrying every day if, seeing how sick my sister became, and then worrying about if my mother would contract this awful uh, uh, epidemic. So it's been a trying time for our members, for all of us, and for the world to see how this has changed our lives. And for that reason, we have to realize that these jobs should be paid better, that they need good insurance, that they have good benefits, that our families and all the people that do these kind of jobs can take care of their families with dignity, and realize the dangerous situation they put themselves in every single day when they go into work in these nursing homes, or in home care, or in whatever healthcare field they're in. They're really putting their lives at risk. And so these workers should be just not called heroes, but pay them like heroes, and make sure that the state recognizes the work they do deserves better pay. And so we have to advocate our legislators to realize that, the pay is too low, and people need to work not 2 or 3 jobs, which is what's happened also, that we realize how the spread of COVID-19 happens is when people have 2 and 3 jobs, they leave one nursing home to do private duty or another nursing home. They're really spreading this disease. And so it's so important that people have one good job that pays well, so they don't have to work 2 and 3 jobs. It's so important that the community understands that this is a very dangerous, and people have been complacent with what's going on, but they really shouldn't. They should realize that they can bring it home to their loved one. And so that's why my work with 1199 is so important, to really advocate for better wages and better benefits and better insurance, because these jobs are performed mostly by Black and brown folks. And so we need to improve Connecticut, especially the work that these people do in Connecticut and the pay they have, whether it be with staffing. Staffing is a big issue because a lot of people have become very ill and not been able to return to those jobs. So we need these jobs to be very well-paying jobs. I'm a little nervous, so I apologize. I also would say that, you know, we have to really open our eyes and understand that healthcare is an important part in our life, and we need to make sure that these jobs are safe for our members, that the proper PPE is provided, that you know, there's hazard pay, and we have to continue the fight to improve these jobs. I also wanted to see if Reina joined us. She's one of our home care workers, because I don't want to take a lot of time.
So Maribel, I have to interrupt here. Reina is actually still with a patient at the moment. So she, oh.
Not to worry, Carmen. We can keep this show moving. That is what I am here for. I have some really important questions for both Maribel and Gerald. And what we'll do is be completely flexible, right? Because we know that Reina right now is both trying to juggle what Maribel is talking about, working, taking care of her family, taking care of the elderly, and then at the same time trying to share her experience with us on this platform. So we're all going to be very graceful and patient and hoping that she can come on. So, you know, we have one question that came in and, you know, that talks about, this is for both of you. What can people do on this call to support healthcare workers? What are one of the, I think, you know, folks throughout this entire COVID process, you definitely have seen the rise of people saying, what can I do to help? If I'm in a position of privilege and power, if I'm in a position where I can assist in some type of way, what can I do to help? And we would love to hear from you. You know, what is it that the healthcare workers need? How is it that there can be a better support system in place? You know, you're sitting in a conversation that's facilitated by a foundation that supports initiatives, you know, for the most marginalized. So if we can kind of really clearly articulate that, that would be really wonderful, not just for our audience, but for those that are prepared to you know, to support in any way possible.
So I would say, let's get involved politically. Those people that we vote for are the ones that are decision makers in our state for our state budget. And so we need them to understand, and that everybody, you know, call their legislator and say, we need to do better for healthcare in our state. Help these nursing home workers or domestic workers or anything in the healthcare field. It's the foundation of making sure that people get better and stay safe. So we need to make sure that they hear us and understand that there needs to be money put into a state budget that reflects our values for taking care of our weakest and frailest people in our state. And so how we show our values is making sure that these workers have the PPE they need, the pay they deserve for putting themselves at risk every day, and making sure that they have the staffing, because staffing is a big problem in our state. And so, you know, advocating and talking to those legislators and pushing the envelope to help them understand how critical this is for because when our community does well, when our members do well, our community does well, it impacts every part of our life. So making sure that they hear us and that we advocate for those things that we need.
If I can add something,
You know, that's such a, yeah, no, go ahead, Gerald. Yeah.
I mean, one of the key things that I worry about in our community, especially, and something that we can do to help safeguard our healthcare workers is, you know, walking the talk and using PPE ourselves. And I mean, I see this all too often where, you people who look like we do, Spanish speakers, Black and brown, are not wearing masks when they should be in the supermarkets. Even, I was over the weekend getting my car fixed, and there was somebody who obviously Latino, and well, not obviously, I'm speaking to him in Spanish, very definitely Latino, and not wearing a mask, and making a point that we stand up not just for ourselves but for our brothers and sisters. When we see this, we have to say something. We have to say, hey, this is not just about me taking care of me. This is about you taking care of you. If you have an extra mask, hand it to them, so that we can make a little dent in our prevention as well.
Yeah, I think you both are making such great points, especially, Maribel, I'm going to go back to something that you said about, if wages are not living wages for healthcare workers, then that means that they're forced to have multiple jobs. And that means that they're entering into multiple environments that put them at risk for infection. And what we know from the data that's been collected thus far in terms of COVID-19 and the Latinx community is that the fact that most Latinos are essential workers and that their jobs require public interaction is what is driving the infection rate. And at the point that we're talking about that 11 million people in this country have been infected, and we're almost nearing 250,000 deaths, that does create a very problematic situation. And to your point, Gerald, is there enough PPE even, right, for essential workers and healthcare workers and CNAs that are going from one environment to another to change their PPE, to have, it on demand, so that if they're having to take care of their families, this is all possible, for them. So access to PPE is also so important to, to this equation in terms of what's been happening. There's another question that came in terms, this was for Jerry. What are the unique barriers for the Latinx small business owners in terms of COVID? And if I can add a little mini question B, part A or B to that question too, is like, if you're a healthcare provider or you're in home care, and you work for an agency, or you're interested in also building your own little business, like, what is the process for that? We have some folks in the audience that are considering that. So both, just to repeat the question, what are the unique barriers for the Latinx small business owners, community in terms of COVID? And then, are there any opportunities right now to create businesses or small businesses within this arena, if that's something that someone's interested in doing?
Well, gosh, so much is coming to mind. Thank you for those questions, Dr. Akbar. And I'll start with your comments at the beginning. Really spoke to me. My father is also a senior. Some people on this call may have met him. He was for 35 years. He likes to say selling Puerto Rican goods, everything from quenepas to dulce de coco and all kinds of great stuff from Puerto Rico. I say he sold heritage and pride over at the flea market on Kimberly Avenue, and now the flea market in Wallingford. And so, what you were talking about with your mom really spoke to me. I worry about him every day in terms of his using a mask. And the long-winded way of saying that we are a very diverse community. When people talk about the Hispanic, the Latino, Latinx community, we are not all the same. And it is, I think that there are many in some segments of the Latino community, Ecuadorians, Peruvians, who have, in particular, who I see all the time coming to us and looking for guidance and support in building their businesses. I think culturally, there's an issue of trust with some others among our broader Spanish-speaking community, and a willingness to ask questions and to seek help and to seek advice. A question that came up before, for example, is do we work at the city with undocumented? We not only work with people who are undocumented, we are proudly a sanctuary city, and we will never ask anyone where they are from or for identification, whether they are documented or undocumented. That is not a question that we're interested in, frankly. So I think one of the challenges still is language. A lot of and a willingness to transact in English or outside of Spanish. And I'll give you an example. A bakery in New Haven that I'm very, very fond of. We were talking with them about expanding their business, and they said, you know, we already have expanded it as far as we think we can. And I said, well, what do you mean? And they said, well, we sell to Puerto Ricans, we sell to Mexicans, we sell to Dominicans, we sell to Peruvians. I mean, we have little bits of everybody's culture here. What else is there? And I said, well, there's a whole big world out there of that is not Latino. And the person said to me, do you think they'd like us? And that was such a profound moment for me, because it speaks to some of the hesitation I think that we feel sometimes when it is not necessarily necessary, but it's very, very real. So what kinds of opportunities are there? Well, whether it is through programs like ours, DNA of an Entrepreneur, well, we will hold your hand in English or in Spanish, and we will tell you what you can do, not that you can't do. We will help you work on your credit if that's an issue. We will help you work on your business, whether you're documented or undocumented. We never put together a business plan. Guess what? Everybody's got to start somewhere, and we'll be patient with you and go at whatever pace that you like. We know of people who are very successful who in our community who are not documented, and we discuss with them how to take their businesses to that next level too. And that is who we are. We are about the Progreso Latino, if you will. We are about serving the whole of New Haven, as I said, with an eye toward the Hispanic community. What was the second question? Forgive me. The first was, what can we do specifically to help Hispanic businesses? And what particular barriers? I think I kind of brought the two questions together.
You did, and you sort of answered it. Yeah, and then, Raquel Santiago Martinez, who's one of the PLF advisory board members here, also said, and you kind of touched on this already, is that, what has been the possibility in terms of communicating appropriately and effectively overall into the Latino population that is Spanish speaking only, right? So like, how do we get this information across, Maribel and Gerald, to, my mom, interestingly enough, right? So my mom was a CNA too. So she used to take care of the viejitos, and now she's being taken care of, right? And so, this is the ecosystem, this is the cycle, and she's 100% monolingual. So, I'm constantly having to make sure that her needs are being met, because there's not, oftentimes there's somebody there that can translate, but if there's not, we have to make sure that, on either ends of the spectrum, that the needs are being met and that there are advocates in place to make sure that they do that. So any thoughts on that? How do we support the monolingual Spanish speaking community who perhaps there are lots of language barriers from this perspective? Is there any suggestions that either of you would have in that area?
Well, I know in the nursing home that I came from, they had a floor which was designated Spanish floor, and they had the Spanish staff working on that floor. And they catered. They made sure there's arroz con gandules once in a while, and pernil and some Latin flavor to their food. They would have a certain day that would be Latino Day, and so that's a great way that nursing homes have been able to do that, have a certain floor to cater to their population. And the residents all speak Spanish, so they're able to communicate with each other. And have a good time talking to each other in the lounges and whatnot. But I wanted to say from the question earlier, we must support Latino businesses and Black businesses in our community instead of big corporations like Amazon. Buy local and support your local community and our own community so we can all thrive. And so, Amazon already has billions on top of billions. Let's support our community. Everybody
Yeah.
wants to go shop on Amazon. Let's shop our local stores, our local Cherry Valley, or our local, businesses that are in our community. And then let's help each other because
That's
our
so
community
true.
will thrive if we do so.
That's so true. I mean, and that creates a positive economic impact, right? And like when we're supporting Black and Brown businesses, and our dollars are going, they, first of all, the dollar lasts longer in that ecosystem. It extends longer. It supports not just the business, but the families that they're taking care of, their workers' families, right? So that's such an important point. Thank you, Maribel, for that. I have another question that came in that talked a little bit, just to sort of round out this conversation around, people who are identifying with the story that we've been telling, my story about my mom, Maribel, your story about your mom, and Gerald, your dad, that they have an elderly parent that they're also worried about, some who are in facilities, some that they're caring for outside of facilities and in the home, having the CNA come into the home, right, and take care of their elderly parent. And there was an article that came out in the New York Times a couple of months ago. It was prior to COVID, but then there was a follow-up article after COVID in terms of the isolation that the elderly feel because there's so many the lack of resources for them, and the lack of community has really changed in our society. As we've become just more globalized and attached to, our phones and other ways of connecting with one another. And so how do we offset this isolation for the elderly? And what can we do to assist with this process? Again, those members in this audience that are powerful brokers for change that want to support are really asking those types of questions.
Well, I can talk about the nursing home industry.
Yeah.
So in March last spring, every day when the epidemic started, we would get calls like all day of CNAs crying, talking about what is happening in the nursing home, what is going on, why are all these people falling ill, and our residents are dying at alarming rates. Because at some point we didn't, even though our presidential administration knew what was going on, did not share that information. Maybe if that information was shared much sooner, we could have protected all these nursing homes that suffered through this, and it's probably saved, the 3,000 residents that have passed. And so understanding that the CNAs have stories to tell, and they have told many stories of holding their residents, and their residents knowing and being aware of what's going on and afraid. And so those CNAs are holding those residents' hands and supporting them and telling them it's going to be okay. I had one CNA call me, and she's crying, and she had me crying. It's like, what's going on is so terrible. And then this little lady says to me, "I'm glad you're here with me, though. I appreciate you, babe." So understanding that there's great pain, and now it's starting over again because we're seeing spikes in nursing homes again. And so
Yeah.
understanding that
Yeah.
CNAs are putting themselves at risk and helping to take care of our vulnerable residents. And so we need to support them, and really people, please social distance and take care of yourself, wear your mask, and be careful because it's still out there and it's very dangerous.
And I'm glad you brought that up. And as we're wrapping up now, Maribel, that, you're saying the cases are on the rise again. And again, what the data is showing us is that when I talk about that, almost 250,000 deaths that have happened as a result of COVID, nearly 3/4 of those deaths have happened in long-term care facilities, including nursing homes and assisted living. So this is not something that like we're just theorizing about, right? Like this is serious, and it's really impacting not just the residents of those facilities, but the CNAs and the nurses and the health staff that are there every day caring for the elderly. So we're going to just wrap up with this last question. And it's about how can we, this is Camila who asks, what can we do to collectively push the state of Connecticut to allocate funds for undocumented immigrants to cover basic services through the pandemic, given that they've been cut out of government assistance? And there's a associated question that came in that also talked about that a lot of small businesses are required to get their own PPE and in order to return to work. So how do small businesses, so here is kind of like the same side of the coin, right? Like what can we do in terms of government assistance? If you're an immigrant or a small business owner, the requirement of PPE to protect themselves and their employees, what else can be done for this access of this essential part that we know that it is the number one factor that will disrupt infection, right? We know that it's documented despite some other folks saying other things, but from the scientists, we understand that that is the most important factor. Any closing thoughts on that?
Well, I would say that on Thursday, we're having a rally at Woodward Street in Hartford. And we're going to be advocating for a better health care, better services for everyone, and join us in a coalition of different organizations and unions that have joined together to really put this out in our state, that the state has to help our community, right? We pay our taxes and they need to help our communities. And whether it be small business or large nursing homes, they need the proper PPE, they need the proper pay, and because these people are putting themselves at risk. So join us on Thursday at 12 and in Hartford on Woodward Street.
Wonderful. And we'll get that information from you. And hopefully, Carmen, we can post it on the chat so people know where to go to support Maribel and, give you information if there's anyone else that wants to support in any other way, including donating of PPEs. Please reach out to Maribel because I'm sure she would be delighted for you to show up and help out in the most the best way possible. Gerald, any closing thoughts regarding that question?
Well, I would just say along the same lines as what Maribel is saying, one of the cool things, the wonderful things about New Haven is that people are really accessible. And I encourage anybody who has taken the time to join us on this call to reach out to us. I mean, we are people who know how to connect you to other people if that's what you are looking for. But to Maribel's point, there is, and I'm a proud union baby myself, UFCW. So, there is strength in numbers, and participating in and making your voice heard is really critical. The city has distributed masks and other PPE equipment, and we're constantly looking for more to get out there to our small businesses owners. If you are a small business owner, please do. If you didn't catch the beginning, there's funding available. I put my contact information in the chat box. There's a new grant for $5,000 to businesses that have been impacted negatively by, and it's available statewide. Businesses that have been impacted negatively by COVID-19. There's a partnership between the Community Foundation, the City of New Haven, and HEDCO for Black and Brown and women-run businesses. there are resources there, and give us the opportunity to connect you to them, and we want to very much so.
Thank you so much, Maribel, Gerald. This was so informative, even for me. You guys have me so riled up and passionate about this, and I love connecting con la comunidad, and making sure that we all have a piece of this, right? We all take the opportunity to move this agenda forward. From our friends at the Community Foundation, please, we urge you to fill out the evaluation and the survey that will be sent to you after you leave the webinar, so that we can continue to improve the messages that we bring to you. And thank you so much for joining us, our audience, for the provocative questions. And we hope that we will be able to continue to take care of our most fragile, our elderly, and particularly our healthcare workers who have been nonstop supporting our community and making sure that they're at the front lines taking care of us. So it was a pleasure to be here with you guys, and we look forward to continuing this conversation. Thank you so much.
Thank you.
Thank you.
Juntos podemos.
That's right. Bye-bye.